I'm Dr. K GIREESH, physician, neurophysician, and neurosurgeon. This is a continuing medical education program, part 8, jointly organized by Padma Clinic and Nursing Home, Chennai, and the Lions Club of Madras Excellence, Lions Clubs International, District 324A5, now presently District 324K. This is on a very important topic, preventive measures for the third wave of corona by the MHS formula. We can actually say that MHS formula is revisited. Now, how to protect ourselves from coronavirus variant or the Omicron infection? And that's the MHS formula. M means mask, H is hand hygiene, and S is social distance. MHS formula: mask, hand hygiene, and social distance. Now, masks, there are 3 types of masks. One is the N95 mask. The other is the surgical mask. And the third one is the cloth mask. So we have 3 masks: N95, surgical mask, and the cloth mask. Now, any one of these or each one of these should have 3 layers. Very important. As you see here, we have an inner layer and an outer layer. And then there is, in between the two, there is a middle layer. So the inner layer, in fact, absorbs the breath. Middle layer will filter the organisms, and the outer layer absorbs the outside organism. So every mask should have at least 3 layers. The inner layer absorbs the breath, the middle layer will filter, and the outer layer absorbs the outside organism. Out of these, the N95 mask can be used by the health workers. Now, if you're wearing the N95 mask on day 1, take for example on Monday, then that particular N95 mask, put it in a paper bag, and you can reuse it after 7 days. That means most probably with the next week, Monday. So you should have at least 7 N95 masks. So day 1, you have an N95 mask being used, fresh one. Day 2, a new N95 mask. Day 3, day 4, day 5, day 6, day 7. New N95 masks are being used. When you come to day 8, you can use the day 1 N95 mask. It can be reused because N95 masks, if you wash it or if you autoclave it, the filtering efficiency will go down. Therefore, N95 mask can be reused after the 7th day. That means by the 8th day, the virus, whatever it is, the organism will automatically die. That is why each mask, keep it in a paper bag and write the date that when it has been used. So N95 mask can be used by the health workers, be it doctors, nurses, ward attendants, and all health personnel working in the hospital. N95 mask can be reused up to 4 times. N95 mask can also be used by personnel when they are treating patients at home itself, when they are in quarantine. And the other one is a surgical mask, as you see here. That can be used by when you're doing any procedure, number 1, 2. Again, it has to have 3 layers and can be used maximum up to 8 hours. After that, it has to be disposed. That is the surgical mask. Cloth mask. Again, you should buy cloth mask which has got 3 layers. And the cloth mask can actually, if you're wearing day 1, The second day, you can actually wash it and dry it and can use it on the third or the fourth day. So cloth mask also, please have 3 or 4 with you. So that day 1, you're wearing the cloth mask. The second day, see that you wash it with soap and water and dry it in the sunlight before reuse. Cloth mask can be reused up to 1 month. Very important. N95 mask can again be reused up to 1 month. When you cough without wearing mask, that's what you can see in the picture, how the salivary droplets go up to 2 meters. But in the down slide, you see the slide below, when you cough while wearing a mask, the salivary droplets can go up to only 2 centimeters. That's very important. You can see this picture. So when you cough without wearing a mask, the salivary droplets will go up to 2 meters. And when you cough while wearing a mask, the salivary droplets can go up to only 2 centimeters. And you can see it in the picture very well. Studies have shown the Reader B, White L, Burns MR, and published, that is, the control, masks wearing can control SARS-CoV-2 transmission in the USA. A cross-sectional study has been published in the Lancet Digital Health 2021. That is, the SARS-CoV-2 infection or variant is usually transmitted predominantly by the inhalation of the respiratory droplets, which are generated when people cough, sneeze, sing, and while talking. CDC recommends the community use of masks to prevent the spread of infection. Masks prevent the emission of virus-laden droplets by the wearer, and masks also help reduce the inhalation of these droplets by the wearer. So that's very, very important observation that has been published in Digital Health. So wearing a mask is very, very important when the present third wave of infection is occurring, especially the community spread. Multi-layer cloth masks, face shields can block up to 70 to 80% of the droplets and limit the forward spread. Lindsley has in fact studied and published this in the Aerosol Science and Technology 2020. So wearing a mask is very, very important. Now, when one should wear a mask, one should wear a mask at home if someone is sick. One should wear a mask when going to the market. One should wear a mask when going to the departmental stores. One should wear a mask when going for group meetings. One should wear a mask when going by bus, trains. One should wear mask when going to hotels. One should wear mask when going to the hospital. And also one should wear mask when if someone's sick at home. Very important. There is another very important question. Should senior citizens, when they are at home, should they wear masks? Senior people, when sitting in a separate room, they do not require a mask. Very important. When they are at home, when they are sitting in a separate room, and when there is anybody in the room, they need not wear a mask. But when the senior people are sitting with the family members, they require to wear a mask because the younger family members will be going outside and they come home, they might bring corona infection. As you all know, presently, the third wave, the infection is spreading rampantly. It's just not enough you wear the mask, but you should know how to wear the mask. You have to hold the mask like this, as you see in the picture. First hold the ear loop of the mask and then put it over your earlobe. Then fix the metal clip of the mask on the bridge of the nose and then stretch it properly so that there is no gap between the mask and your face, and stretch the lower end of the mask. So this is how you have to wear a mask. First, hold the ear loop of the mask and wear it. That's the ear loop, is this one, and put it over the earlobes. Then fix the metal clip, which is supposed to be here on the bridge of the nose, and then stretch the lower end of the mask. That's it. And this is how we got to wear a mask. Don't touch your eyes, mouth, or nose with unclean hands. Very important. Without our knowledge, we keep touching our eyes, nose, and mouth at least 23 times in 1 hour with our hands. If our hands have the virus, it will enter the body through the nose, mouth, and then enters the lungs. This is the most common method of spread for infection other than the inhalation. Therefore, do not touch the face, eyes, nose, and mouth with unclean hands. Otherwise, wash your hands with soap and water before touching the face. A face shield. Besides wearing the mask, you must always have a face shield. A face shield will prevent you from unnecessarily touching your nose, mouth with unclean hands, also touching the outer surface of the mask. The outer surface of the face mask will be having organisms, can be bacteria or viruses. Therefore, it is better not touch it. Therefore, have the face shield. A face shield will prevent you from unnecessarily touching your eyes, nose, and mouth with unclean hands. Also prevents you from touching the outer surface of the face mask. Face shield protects eyes, nose, and mouth. Face shield prevents people from touching their face inadvertently, exposing to coronavirus. Face shield, of course, can be reused after washing with soap and water. When wearing a mask, these are some of the important things, because people do wear masks, but they should know how to wear masks in a proper way so that they will not get the infection. When wearing a mask, don't touch on the outer surface of the mask. Very important. The outer surface contains virus. Don't pull the mask below the chin to the neck, because the neck is exposed and the neck will have sweat and organisms. The mask will absorb it, and then you will pull the mask again back to your nose, and the bacteria and virus enters your nose then and there. So when wearing a mask, don't pull the mask below the chin to the neck. Neck contains sweat and organism. The mask will absorb it. Then you will pull the mask up to your nose. The virus will enter your nose and mouth. So do not bring down your mask to the chin. You can see below the chin on the neck, it is exposed, contains virus and bacteria, and you find the mask absorbs it. And when you pull the mask again back to the nose, you find the whole bacteria goes into the nose. Now, when you're wearing a mask, you would like to remove it. You like to drink coffee, tea, or water. Now, how do you remove the mask? Very important. And then again, put it back. That is what is shown in this slide. First, hold by the ear loop for the mask and remove it. Keep the mask on a clean table. Then after that, wash your hands with soap and water. Then drink coffee, tea, or water. Then back to again hold the ear loop and then wear the mask. Don't touch on the outer surface of the mask. After that, clean the hands with soap and water or hand sanitizer. These are the important steps. That is removing the mask and then drinking coffee or tea and later on putting it back. For doctors and anyone treating COVID-19, the full body mask will have to be worn by the doctors, nurses, and healthcare workers when they're going to treat COVID-19 patients or those affected with Omicron or the variant. Special training is in fact required for this. That is wearing, and then of course that is the donning and the doffing, that is removing. There is a special training which has to be given, and for all the healthcare workers, this training is very, very essential so that they should not get infected. Doctors and healthcare workers are doing a great service to humanity. There is no doubt about it. And they're doing very hard work to serve the corona patients. So that is about the mask. MHS formula, the mask I have told you. The next component is a hand hygiene. Now, why the hand is more important? Because the organisms will come and stick to your hands. Either when you touch the doorknob, you can get it, because everyone handles the doorknob, or it may be on the table, or it may be from the papers or case sheets, case notes, or it can be anywhere. Even if you go to the grocery, buying or ticket articles, you'll be touching on that. And thereafter, when you touch, the organism reaches your hand, and you can see here, suddenly your nose will scratch, and then you'll rub your nose, and the organism will start going into your nose and the throat. It starts multiplying here in the throat, and then descends down into the lungs, into the veins, and starts multiplying. This is exactly how the organisms get into the nose and the mouth, by the unclean hands. Through the unclean hands, the virus can enter your nose and mouth and starts multiplying in the throat, and thereafter it goes down into the lungs. So hand washing is again very, very important. Apart from wearing mask, mask always prevents it, the inhalation of the viruses. Wash your hands regularly with soap and water at least 10 to 15 times per day. Keep an alcohol-based hand sanitizer ready when the soap and water are not available. Now, washing your hands with soap and water is the best compared with hand sanitizer. And as you see in the slide, here there is a red color, that is a fat band. There is a layer of fat actually, and this is the virus that is inside. There is a layer of fat surrounding the virus, which gets removed with the soap particles, and the virus gets killed and removed with the soap lather. This happens after 20 seconds of washing the hands. So there is a ring, the fatty layer, the soap removes it, and thereafter the virus inside is being killed, and thereafter washing for 20 seconds, the soap lather removes off the virus from your hand. So washing hands with soap and water is the best. There is a layer of fat surrounding the virus, which gets removed with soap particles, and the virus gets killed and removed with the soap lather. This happens after 20 seconds of washing hands. When to wash hands? After coughing, especially when you cover your mouth with your hands. After touching the door, doorknob, sidewall, tabletop, railings, escalators at home and public places. Before and after eating food. Before and after removing the mask which is on your face. All these after, you'll have to wash your hands. Now, there are 7 steps of hand washing which are extremely important, because you will have organisms inside and between the 2 fingers. You can have organisms here. You can have organisms on the back of your hands. You can have organisms between the thumb and the index finger like this. So all those places will have to be covered, and that is what the WHO, the World Health Organization's 7 steps of hand washing, everyone has got to follow, and just not rubbing the hand like this under the water. Just see the 7 steps of hand washing, the practical aspect being done. This is the step number 1, rubbing the palms together. Then rubbing the back of the hands, both hands, back of both hands. That is step 2. Step 3 is interlacing the fingers and rubbing the hands. Step 4 is interlocking the fingers and rubbing the backs of fingers and hands. And step 5 is rubbing the thumb and rotating the hand in between the thumb and index finger. And step 6 is rubbing the fingertips on the palm of both hands. Step 6. Step 7, in fact, is rubbing the wrists of both hands and then washing the whole hands together. It's very important. Wash for 20 to 30 seconds so that all the soap, lather, and all the dirt are gone. After washing the hands thoroughly, dry it with disposable paper towel. That's again, it's not with your handkerchief, but with the disposable paper towel. And dispose it. So research shows that proper hand drying with disposable paper towels is also very, very important. Transmission of microbes more likely to occur from the wet skin. So don't keep your hand dry after once you wash your hands. When greeting someone, don't shake hands, but instead do namaste or just hand waving or hit with the elbow. Very important. That is the H component of the MHS formula. We have seen the mask, hand hygiene, and the third component is the social distance. Yes. Keep a distance of at least 2 meters from anyone. As you see in this slide, if anyone coughs, the soft salivary droplets can reach up to 2 meters. Studies have shown that. So therefore, mask, hand hygiene, social distance are the 3 mantras to prevent the spread of corona infection or the variant infection or the Omicron infection. Mask, hand hygiene, social distance are the 3 mantras to prevent corona infection. Therefore, please observe the MHS formula, each one and every one of you. Mask, hand hygiene, and social distance. That's a brief, my dear brothers and sisters, on the preventive measures for the 3rd wave of corona using the MHS formula. Thank you very much.